Wishing everyone a wonderful day from Onep. Today is the middle of the week, and for the first time, I'm hosting Dr. Sir Khan outside the operating room, which is quite rare since we hardly ever see him elsewhere. Doctor, how are you? Yes, we spend almost the entire day in the operating room. Occasionally, we step out to update patients, but it's rare to cross paths otherwise. Today, we'll talk about something a little different about surgeries. Doctor, most of our patients probably won't recognize you today, since they usually see you wearing a surgical cap and scrubs. But today, I caught you just before surgery. I'll ask you a few of the questions our audience often asks me. Doctor, you perform facelift surgeries. What is the right age or right time for it? Actually, age is often misunderstood when it comes to facelift surgery. The main point is the indication, meaning the patient's actual condition. We've performed facelifts on patients in their 20s, as well as on those in their 50s. What matters is the patient's concern. If someone in their 30s or mid-30s has sagging in the face, mid-face drooping, loosening under the eyes, and some degree of skin laxity, then they're a good candidate for a facelift. For some patients, this deformation process progresses slowly. For others, more rapidly, especially for those with heavier facial structures. Lighter faces age more slowly, so rather than focusing on age, we focus on the issue itself. If the patient has a problem, we treat that problem. It's not about applying one technique to every patient, but rather tailoring the technique to each individual. In the 30s, sagging often starts in the mid-face area around the temples where the brows begin to descend. The neck area usually isn't affected yet. That's why for patients in their 30s, we often prefer an endoscopic facelift, a scarless surgical technique. Why? Because there are no visible scars, no permanent deformities, and no obvious signs that the person has had surgery. So between ages 30-40, we generally give more weight to endoscopic surgery. The advantage of this approach is that the patient continues to age naturally without looking aged in the process. When we lift the midface and eyelids early on, they experience this period with much less trauma. In later years, when sagging begins in the neck area, we add a neck lift as well. Some patients come to us when sagging has already affected the midface, upper face, and neck altogether. In those cases, we perform a total facial rejuvenation. This involves tightening the neck area, repairing neck muscles, removing excess fat, rejuvenating the mid-face, lifting the brows, removing excess eyelid skin, and reducing under eye bags all at once. If there's a problem, it should be addressed, but if there isn't, then it's best to wait until the right time. So age alone is not the determining factor. The key is to design a treatment plan based on the specific needs of each patient.